Good morning, good afternoon, and good evening, everybody. My name is Saima Asghar. I am Director, ISSUP Pakistan Chapter. Welcome you all and thank you for your interest in joining us. Today, we as National Chapter ISSUP Pakistan, in collaboration with Ministry of Narcotics Control Pakistan, UNODC, INL, International Narcotics Law Enforcement Pakistan, International Narcotics Law Enforcement, United States of America, ISSUP and ISSUP Pakistan hosting this webinar on a very important topic, quality assurance of drug treatment services in Pakistan. And it's a great honor for me to share that we have a wonderful speakers from Ministry of Narcotics Control Pakistan, International Society of Substance Use Professionals, International Narcotics Law Enforcement, United States of America, United Nations Office for Drugs and Crimes, and ISSUP Pakistan as well. Actually, this webinar will bring together a panel of experts who will provide insights into the UNODC drug use disorder treatment system, quality assurance toolkit, 5 standards and lessons learned from 4 provincial training in Pakistan, which was conducted in March 2021 for drug use disorder treatment professionals. And the Ministry of Narcotics Control Pakistan will present the mandate and efforts of Government of Pakistan to address this issue. And after that, ISSUP Pakistan will present how they can plan and intervene to address the quality of substance use treatment in line with the international standards for drug treatment of drug use disorder, which is shared by UNODC WHO. Now, I would like to say a huge thank to all ISSUP team, particularly Ma'am Joanna, Ms. Livia, Ms. Ola, Ms. Ola, and Mr. James, who help us and support to set up and finalize this event and provide us this fabulous platform to share knowledge and opportunity to learn from each other. We are also very much thankful to UNODC Pakistan for their great contribution to make this event possible. And I am pleased to share that today, 836 people has been registered for this webinar and who showed their interest to learn about quality assurance of the drug treatment services in Pakistan. And that is really an outstanding response. Thank you all once again. And there is also a good news I'm going to share through this webinar for our ISSUP family that Ms. Livia Edger, Deputy Director, ISSUP Global, has been awarded with the International Collaborative Prevention Research Award 2021. Actually, this webinar recognized Ms. Livia's significant impact in making evidence-based intervention a reality in many communities in Latin America and in other parts of the world. So on behalf of Mr. Bashir Ahmad Naz, President, ISSUP Pakistan Chapter, and the entire family of ISSUP Pakistan's National Chapter, I would like to congratulate Ms. Olivia for this great achievement. Now I'm coming back to the webinar, and for our audience, I would like to share that if you have any question, suggestion, or want to send any suggestion or feedback, please use the chat function or question. We'll be monitoring this webinar, this function throughout the webinar, and after the end of formal presentation, we will respond some of you, or we'll request our panelists to answer some of your questions. So we are moving for our honorable speakers, and it's a great honor and pleasure for me to share that our first speaker is from ISSUP Global, an International Society of Substance Use Professionals. So Ms. Olha, she is a National Chapters Coordinator of ISSUP, and we, on behalf of this webinar, we would like to welcome Ms. Olha to share his remarks. regarding this webinar, please. Welcome, Ms. Olha.
Thank you, Ms. Saima. Dear colleagues from ISSUP Pakistan, dear speakers, dear ISSUP members, on behalf of ISSUP Global, I would like to congratulate you on this ISSUP Pakistan webinar. The International Society of Substance Use Prevention and Treatment Professionals, ISSUP, is a unique international membership organization focused on drug demand reduction, substance use prevention, treatment, and recovery. ISSUP operates at the national level through the national chapter, a multidisciplinary organization undertaking the work and role of ISSUP in the country. We are very happy that ISSUP has established a national chapter in Pakistan with 1,500 members. ISSUP Pakistan national chapter is continuously undertaking many different activities from training, research to a variety of different local and international events. Quality assurance of drug treatment services and the implementation of the international standards of treatment of drug use disorders are one of the highest priorities for our national chapters. We are aware that building effective quality assurance mechanisms and tools require knowledge, experience, and systematic evaluation of the services delivered. ISSUP would like to thank our international partner organizations that share their expertise in this field and support ISSUP Pakistan event. ISSUP would like to achieve the goals that the international standards of treatment will be implemented in the university curricula and that those with substance use disorders and their families receive access to evidence-based, high-quality, best treatment services. Quality assurance of drug treatment services and ongoing evaluation and improvements form a long and continuous process that requires effort, time, and commitment. I am sure that we will succeed together. We thank ISSUP Pakistan for raising this important topic, and we wish you good luck and further development in this area. Thank you.
Thank you very much, Ms. Ola, for your wonderful remarks, appreciation, and to assure your support as ISSUP. We are very much thankful to having you with us, and it's a great honor for you, for your precious time, and we are really much thankful to you once again. Thank you. Now I'm going to introduce our second speaker, Mr. Sabino Sikandar Jalal. He is a Senior Joint Secretary, Ministry of Narcotics Control, Government of Pakistan. And on behalf of ISSUP Pakistan and other collaborative organizations, I would like to welcome sir to share your remarks. And later on, we also have a presentation of Mr. Sikandar Jalal. Thank you, sir, and welcome.
Thank you very much, dear participants, colleagues, ladies and gentlemen, and especially my friends from the UNODC, Mr. Jeremy Milsom and INL, Cristian. Good to see you all here after a long time. So we're all pretty much aware of the lack of, drug dependence treatment facilities in the country. There's actually a dearth of such treatment facilities in the country. Compared vis-a-vis the drug dependence in the country, the treatment available is very shoddy and very poor, and there's really no mechanism and coordination in relation to any best practices being followed around the globe. So we in the ministry and from help and consultation from our partners in UNODC and assistance from our very generous partners in INL, we realize that we need to work on these gaps that are glaringly visible to everybody within the system of drug treatment in the country. So in order to address that, we realize that first of all, we need to address the issues, the policy issues that are the public policy issues that are related towards drug treatment in the country. And for that purpose, we've started on building up an infrastructure, a sort of a software for developing standardized treatment facilities in the country. And towards that end, we hired UNODC, hired a national consultant to come up with a plan to address this issue. And we have drafted some legislation for formulating, a legislative basis for a regulatory body to address these issues within the country, and we started working on it. And we're coordinating with all the relevant agencies. The provincial governments were very important after the 18th Amendment devolution of all the powers to the federating units. We have to take them on board, and we're consulting with them, with Ministry of Health, Ministry of Education, and we are in the process of developing a comprehensive formula method for addressing these issues. And hopefully with the help of our partners in INL and UNODC, we'll be able to come up with a concrete mechanism to address all these issues. So thank you very much, and I look forward to presenting all the details that we have garnered and learned from our partners and the consultants and situation on the ground during the course of my presentation later on. Thank you very much.
Thank you very much, Sir Sikandar, Jalal, for sharing the initiatives and efforts of Government of Pakistan, especially Ministry of Narcotics Control for drug demand reduction, treatment, and especially to take new initiatives for drug to assure the quality assurance in Pakistan for drug use, especially. And now it's a great honor for me to invite and introduce our next speaker. He's already very well known across the world. And he's Dr. Jeremy Milsom, country representative of UNODC Pakistan. Welcome, sir. Please share your remarks regarding.
Thank you. Mr. Sabino, Jalal, Senior Joint Secretary, Ministry of Narcotics Control, Government of Pakistan, Ms. Olha Myshakivska, National Chapters Coordinator, ISSUP, and colleagues at ISSUP, Ms. Cristian, Martinez-LuSane, INL Pakistan Program Officer, Counternarcotics, Corrections and Rule of Law, dear presenters, participants, ladies and gentlemen, a very good afternoon. Assalamu alaikum. As country representative UNODC Pakistan office, it really is an honour and a pleasure for me to welcome you all to this webinar where we're discussing quality assurance for drug demand reduction, and it's organised jointly by UNODC and ISSUP Pakistan in collaboration with the Ministry of Narcotics Control and INL. Let me start by extending my gratitude to the Government of Pakistan for their very strong commitment to establish a strong drug demand reduction quality assurance framework in Pakistan. And of course, I'd like to acknowledge the Bureau of International Narcotics and Enforcement Affairs, INL, for extensive contributions to ensure quality drug demand reduction services in the country. According to the 2020 World Drug Report of UNODC, only 1 in 8 people have access to drug treatment. And this situation has surely been aggravated even more around the world in the face of the COVID crisis, especially when it comes to vulnerable populations such as women and children. In Pakistan, as per the last drug use survey, which was done in 2013, there's an estimated 4.25 million drug dependents that require scientific and structured drug treatment interventions. Drug use disorders, particularly drug dependence, is associated, as many of you know, with increased morbidity, mortality, and presents a significant burden to affected individuals, their families, and communities. The costs of untreated drug use disorders to countries includes not only costs to healthcare and social welfare, but criminal justice costs and loss of productivity. Evidence-based interventions and treatment have been shown to be effective at reducing the health and social consequences of drug use disorders and helping people stop or reduce illicit drug use and improve recovery outcomes. Yet, according to the World Drug Report 2020, the availability of and access to drug use disorder treatment remains limited at a global level. And as I said, at best, only 1 in 8 people who could benefit from this type of treatment receive it each year. So adequate provision of effective drug use disorder treatment is a global priority in the wider United Nations system. The 2030 Agenda for Sustainable Development, it's acknowledged. Sustainable Development Goal SDG 3, Target 3.5 requests member states around the world to strengthen prevention and treatment of substance, including narcotic drug abuse and the harmful use of alcohol. Now, as many of you know, the nature of drug dependence, it's a complex, dynamic interaction between biological, psychological, and social factors. And various psychosocial factors may increase the risk of both the initiation to drug use and the development of drug use disorders. And in addition, with drug use disorders, some develop other health conditions that are often associated with drug-related health risks and behaviours. Those who inject drugs are at high risk of exposure to bloodborne infections such as HIV or hepatitis C, as well as to tuberculosis infection. And to achieve this SDG target, so it's a target which the whole world has committed to through the United Nations system, it's essential to implement comprehensive, people-centred and balanced policy interventions to remove barriers to treatment, eliminate and prevent where it exists inhuman or degrading treatment or punishment in the name of treatment, provide better care, increase awareness and understanding of drug use disorders in the general population, and improve the knowledge of decision and policy makers, health professionals and other relevant stakeholders. In Pakistan, in the context of DDR, in the past, there's been a lack of meaningful coordination between relevant stakeholders to address drug dependence treatment service and associated comorbidities such as mental health issues, HIV, and hepatitis and tuberculosis. And it's evident, and all of the partners which have been discussing so productively over the past year, it's evident that without a formal mechanism in place to regulate DDR services at both national and provincial levels, the implementation of scientific evidence-based drug prevention and drug dependence treatment services can't be guaranteed. So UNODC in coordination, and I praise the leadership of the Ministry of Narcotics Control and the Ministry of National Health Services Regulations and Coordination, and other relevant government counterparts and UN partner organisations, and with the help of INL, has been working hard on establishing a quality assurance mechanism for the drug reduction services in Pakistan, as outlined by Mr. Sabino, Sikandar, Jalal earlier. And to materialise this initiative, a national technical level committee for DDR quality assurance has been established, as mentioned. A series of 5 training courses on the DDR quality assurance mechanism were conducted at both federal and provincial levels and attended by representatives from healthcare commissions, mental health professionals, social welfare, non-government organisations, UN partner organisations, and others to discuss the existing drug demand reduction practices and what is required and what we all really need to do here in partnership together to achieve international standards for drug dependence treatment and prevention. So we believe that this can be achieved, and it needs to be achieved through a strong, well-coordinated dialogue and networking between partners and stakeholders. So I hope that this coordination with the support from INL will help the government of Pakistan succeed. I hope we all succeed in establishing this strong drug demand reduction quality assurance mechanism in the country. So I'll stop there and thank you very much. Thank you.
Thank you very much, Dr. Milsom, country representative UNODC Pakistan, and we are very much thankful on behalf of our country that UNODC really had a great contribution, especially to understand the needs of Pakistan to address the drug demand reduction services and prevention and treatment fields, as well as to professionalize the people who are working in SUD treatment field as well as in the prevention field. So we are very much thankful to you once again and for your precious time to join us. Thank you. And now I'm going to invite Ms. Cristian Martinez-LuSane. He is a program officer of International Narcotics Law Enforcement Pakistan Office, Counternarcotics, Corrections, and Rule of Law, International Narcotics Law Enforcement. So on behalf of organizers, I would like to welcome Ms. Cristian for your precious time to join us. You are requested to please share your remarks regarding this webinar, please.
Thank you, and assalamu alaikum to everyone. My name is Cristian Martinez-LuSane, and I represent the U.S. Embassy here in Pakistan, particularly the Office of International Narcotics and Law Enforcement, also referred to as INL. I'm so honored to participate in today's webinar on quality assurance of the drug treatment services in Pakistan that UNODC and ISSUP organized today. It's really an honor to partner with you all to make this happen. Thank you to UNODC and ISSUP for organizing the webinar to train more than 800, I believe 830 registered drug treatment professionals to benefit from this training. What an accomplishment, truly. I hope this session will introduce all the participants to the 5 quality assurance standards in drug treatment, as well as the steps that the government of Pakistan, as Sabino summarized, are taking to ensure quality assurance in drug demand reduction happens nationally. INL is interested to learn also from the participants, all the drug treatment professionals, to gain your perspective on the presentations today, including on ISSUP's action plan to improve quality assurance in drug demand nationally. I hope today's webinar will spark ideas as well on the ways to improve quality assurance in drug treatment, as well as build a shared understanding on the importance of having a federal drug demand reduction system that truly engages all stakeholders alike, including you at the provincial level. Your work as drug treatment and prevention professionals is critical to reducing drug demand in Pakistan, and we hope that the presentations today build on the work that you already do to positively impact more Pakistani lives. INL is proud to have supported today's training as part of a larger project in partnership with the Ministry of Narcotics Affairs and UNODC, which seeks to establish the National Committee on Quality Assurance to support efforts such as this one that essentially seek to improve the government's as well as drug treatment professionals' capacity to standardize drug treatment prevention and treatment protocols and its associated services. This MNC-led national committee will, with representation from key federal and provincial level stakeholders, will essentially recommend a national mechanism to strengthen, regulate, and monitor evidence-based drug prevention and treatment service delivery throughout Pakistan. It's a huge undertaking, and we hope the National Committee, supported by the provincial subcommittees, will become the hub for key stakeholders like you to recommend and establish mechanisms to strengthen, regulate, and monitor drug prevention and treatment services. We hope by the conclusion of this project sometime in December of this year that the National Committee will be able to review existing drug demand reduction policies and strategies and plans, suggest improvements and amendments at the federal and provincial levels, standardize drug prevention treatment and drug prevention and treatment protocols and services, streamline drug demand reduction efforts in the country, and facilitate trainings such as this one that help streamline policy and operational mechanisms. This is an effort to support MNC's mission, which is to standardize, regulate, and monitor drug prevention and treatment protocols and services in Pakistan, one of its many objectives under its mission. Your role, participation, and support under this or as part of this webinar are critical to make this unprecedented national drug demand reduction effort a sustainable success. This is an effort we also hope builds on the progress we've made as partners in the years past To date, INL has invested $24 million in drug treatment and prevention efforts in Pakistan. And this could not have been achieved without you, our close partners in the Ministry of Narcotics Control, in UNODC, as well as through ISSUP, Colombo Plan, and other international partners. But as Jeremy Milsom mentioned, it's truly the genuine and hard work of the Ministry of Narcotics Control, the government of Pakistan, to tackle this issue that we've made an impact and seek to make a greater sustainable impact in the coming years. Notwithstanding, we understand anecdotally that drug demand is on the rise. According to a 2013 UNODC national survey in Pakistan, 6% of people in Pakistan said they were drug users of some sort. We hope that a 2021 funded, INL funded national survey conducted by UNODC will give us updated data to get a better sense of what the drug demand situation looks like today. INL remains committed to sharing critical information and evidence-based studies to promote and preserve stability of societies that are threatened by the national narcotics trade. We are proud, again, to partner with the Ministry of Narcotics Control, UNODC, ISSUP, and other partners to expand access to drug prevention and treatment services and training that is science-based and that promotes international standards and best practices. I want to express my sincere gratitude, especially to the Ministry of Narcotics Control Senior Joint Secretary Sabino, Sikandar Jalal, who joins me here today. Thank you, sir, not only for your presence at this session, but also for your continued support and collaboration with INL. Honestly, the impact and work we try to do here in Pakistan would not be possible without our strong partnership. I must also acknowledge the dedicated experts of UNODC represented here today by Country Director Jeremy Milsom, Dr. Manzoor, and Ms. Rashna Niazi, as well as their team. And also, I appreciate Ms. Olha Myshakivska, National Chapters Coordinator of ISSUP, Ms. Annette Dale-Perera, the Quality Assurance Trainer in ISSUP Global and ISSUP Team Pakistan, for organizing this webinar to discuss and educate on quality assurance standards in Pakistan. It's with great pleasure to be here today, as mentioned, to meet virtually more than 800 of you benefiting from this webinar. And please know that INL, MNC, UNODC, and our national and provincial level partners remain committed in building Pakistan's drug prevention and treatment capacity that expand the national prevention and treatment workforce. The fight against drugs is a priority for Pakistan, the United States, UNODC, and the rest of the international community. And drug demand reduction is a key policy tool for addressing the interconnected threats of drug, crime, and violence. So thank you all, especially the organizers, the trainers, and the participants for your interest and participation in this worthy cause.
Thank you very much, Ms. Cristian-LuSane, for your precious time to join us and share the leading role of INL throughout the world, especially for Pakistan, for drug demand reduction services and prevention, and to promote evidence-based practices in Pakistan. So we are once again very much thankful for your presence here and for your wonderful and valuable remarks for us. Thank you very much. Now I'm going to introduce our next speaker and panelist, Ms. Annette Dale-Perera. She is the Director, ADP Consultancy UK, Consultant UNODC, WHO, and Colombo Plan as well. Ms. Annette has worked in the area of substance use disorder for over 35 years. She is a Director of Management Consultancy Company specializing in SUD policy and practice called ADP in 2018 to 2019. Her main contracts include lead consultant for United Nations Office of Drugs and Crimes on a global project on quality standards and assurance within SUD treatment. UNODC Nigeria, helping national experts to develop clinical guidelines, a quality assurance mechanism, and a national strategy for SUD treatment. She's also had Europe-funded work with the Ministry of Public Health in Afghanistan, consolidate and implement drug use disorder protocols. He's also had a great contribution to establish ISSUP Quality Assurance of SUD treatment network as well. Now he is going to present 5 standards of quality assurance of drug treatment as per UNODC drug use disorder treatment system, quality assurance toolkit, and a summary of key findings of the recent national and provincial system of quality assurance training in Pakistan. So he's also had a great contribution to organize and make this event possible. So she's also, we can say, she's the host of this webinar. So formally, I would like to welcome Ms. Annette Dale-Perera to share her presentation. Thank you.
Thank you, Saima. Let me share my screen. It's an absolute pleasure to be able to share this with you. Assalamu alaikum. Thank you very much to ISSUP Pakistan for jointly having this webinar with ISSUP Quality and Treatment Network. I'm going to present the results of national and provincial training and work on drug use disorder systems in Pakistan that was done recently. The work that was done was very, very much a team effort, and I would very much like to acknowledge all of the team who've contributed to the work, and that includes UNODC, UNODC Pakistan office, Dr. Manzoor ul-Haq, Rashda, Nazi, Ahmed, etc. Would not have been possible without the team. The team were fantastic. UNODC Central Asia, including Dr. Jeremy Milsom, who was there often at the beginning and the end of the training. The Senior Joint Secretary of MCM, Mr. Sabino Sikandar Jalal, very supportive of the training, and without whose support, I don't think it would have happened. Also, Dr. Saima Asghar, National Health Services Regulations Coordination, INL for funding the work, and Cristian for also being at the beginning and the closing of many of the trainings. And also, last but not least, the experts from Pakistan. This was a genuine piece of co-production where we analysed the treatment systems in Pakistan, and then the participants made recommendations around how treatment systems could be redesigned in line with international guidelines. Okay. So this is what we did. Basically, we did a national training, and then we went around each of the 4 provinces in Pakistan. And the aim of the training and the work was for the participants to gain knowledge in the international standards for the treatment of drug use disorders, or the standards. So this is our international guidelines on how systems and services should be provided, and then analyse the national and provincial systems against the standards, and then make recommendations of a system redesign. The national stakeholder training was in October, and it had 14 participants from many government departments and some key national stakeholders. We then did 4 provincial trainings in March, Punjab, Sindh, KPK and Baluchistan. All of the training was over the internet. It was 4 days each week. It was very interactive. There was plenaries, breakout, feedback and discussions, and the training itself was rated very well. So nationally, it was rated 4.65 out of 5, and provincial training was rated 4.5 out of 5. And what I'd like to do is present the results of the training. A quick recap on what we'd asked delegates to compare their systems against. So this is our key seminal international guidelines. This is the international standards for the treatment of drug use disorders. Document, it was first published in 2016 and then finalised, field tested by WHO, then finalised in 2020. It's been signed off by all UN member states, and it's designed to help countries deliver and design drug use disorder systems and services based upon scientific evidence. Now, this document is very aspirational, but its UN member states are all committed to work towards implementing systems in line with this key seminal guidance. What does it say? So some headlines from it first. It says, as Jeremy said, drug use disorders are complex biopsychosocial health issues. Drug use disorders are also a spectrum disorder that range from low to high severity and complexity of need. So we have people that use drugs, we have people that use drugs and they're causing harm to themselves and others, and we have people with drug dependence. And there's a variety of different needs that the system therefore should meet for all of these different groups. And we should organise local systems to meet the variety of needs. The international standards also says that systems should be recovery orientated, particularly to help those with chronic and relapsing dependence. So dependence that can last years, that can take many years to overcome, and indeed some people will never overcome. And for these people, because it's a chronic condition, they need support and help over time, perhaps by many different services. Okay, pyramids were very, very important to the training and are very important in the international standards. This pyramid is the key, one of the key diagrams in the international standards document. And what it basically does is it describes the system of services that should be in place in every local area. The local area may be a city, it may be a province, or indeed it may be the country. And what the pyramid says basically is that we should offer the most effective but least invasive interventions first. And this is the most cost-effective way of doing it. So for example, if somebody has a mild to moderate cannabis problem, they should not be offered residential or inpatient treatment unless they have some serious underlying comorbidity. They should be offered outpatient treatment or even self-help. What the international standards also says is that most people should be able to be treated in the community. It also says public investment should match the volume and type of treatment needed, and that we need a systems approach where the services work together, and this is not about individual services working in isolation. Now, in terms of UNODC, UNODC has developed 2 sets of quality assurance toolkits to help countries improve the quality of drug treatment. So UNODC has a services quality assurance toolkit and a system quality assurance toolkit. The 2 things work hand in hand because drug treatment system planning and funding influences services and patient outcomes. And this work focused on the UNODC systems level toolkit. So we were analysing the systems at a national level and then also in each of the 4 provinces. So there are 5 standards in the UNODC system level toolkit. The 5 standards quickly are: firstly, the area has a mechanism that coordinates and oversees the funding, monitoring and review of the drug use disorder treatment system. The second standard is the area has a comprehensive and recent needs assessment that guides the system planning. And this is partially because drug trends change so rapidly, particularly recently. Standard 3 is that the drug use disorder treatment system should feature the tiered or the pyramid model that we've just looked at, with the settings, modalities and interventions outlined in the international standards. The 4th standard is the area has a funded plan to develop and sustain its drug use disorder treatment system in line with the standards. And the 5th standard is the system has planned and monitored mechanisms to enable the system to improve quality, and this includes addressing any inhumane or degrading treatment and also addressing stigma and discrimination that's so often faced by our patient groups. And what we did with the national and provincial training is we analysed each of the systems in those local areas against these standards. Okay, so what we did over the 4-day period is that we systematically looked at each area, strategic planning, need, the non-specialised settings, specialised settings, specialised interventions, where the services were recovery orientated. We looked at resources, we looked at quality initiatives and initiatives to reduce stigma, and then taking all of that information, participants then made recommendations for service redesign based upon all of that information. And it was a very interactive process. So it really was genuinely a piece of co-design. So what we asked participants to do was to rate the system on each standard. And we used something called the BRAG rating. So BRAG stands for colours. Blue is not applicable. Red means the standard is not met or services are inadequate. Amber means that a standard is partially met or services are rated as partially adequate. Green means that a standard is met and that the services were good. And so the participants, the delegates, we systematically went through each part of the system and then rated different aspects of provision using the different colours. So we've got an immediate visual idea of what the participants are saying. And then we also produced a diagram to see how far off the WHO UNODC pyramid model the systems were. So let's have a look at what we found. So what did the participants say in their analysis of the system at a national and a provincial level? So the first thing we looked at was strategic planning. So the questions were, who plans the system? Delegates agreed that there is a good national policy, and previously ministers had been planning, but this was perceived as often being in isolation or in silos. It was acknowledged that recently there was much more of a push for people to come together to plan, and that was particularly MCN and the Health Ministry. Provincial planning was thought to be there in places, but again happening in silos. Coordinated planning mechanisms involving all of the stakeholders was perceived to be lacking, though it had been started by health in some provinces. In terms of who funds drug use disorder treatment in Pakistan, it was acknowledged that there was multiple funding sources, but that these were largely uncoordinated, and therefore the resources could be used better if there was coordination. There is state-funded drug use disorder treatment in Pakistan, which is an excellent thing. Through health, there are beds in all mental health tertiary hospitals. The Anti-Narcotics Force, ANF, fund services, social welfare departments. There was thought to be quite a large private sector, but this was thought to be an unknown quantity and quality. There was donor-funded treatment, charitable funding, and some local benefactors, but this was uncoordinated. In terms of need, so this is system standard 2, it was acknowledged across the board that there was a recent lack of data on drug use. So the latest surveys dated back to 2012, and it's fabulous to hear that INL are funding a survey this year. That's great. Now, the anecdotal feedback from the 75 participants, there was quite a lot of consensus in what people were saying. So there was a general perception that more adults were using drugs than in 2012, and that partially that was due to an increase in the population, but there was also perceived to be a general increase in drug use and a broadening of the types of drugs used. So opioid use was still seen to be a major problem, not least because of the country's proximity to Afghanistan, major opioid producer in the world. There was thought to be widespread cannabis use. There was perceived to be an increase in stimulant use, particularly methamphetamine use amongst young people and young adults and students. And this was a great concern to many delegates. But there was also thought to be more new psychoactive substance stimulant use, including something called flakka. There was thought to be an increase in the non-medical use of illicit prescription and over-the-counter drugs, including opioids, but also tranquilizers. And it was thought that all groups were impacted by drug use, but there was a real concern about some of the impact on young adults. Now, there was very little hard data on drug-related mortality and morbidity, but many groups were thought to be impacted: men, women, students, etc. We asked participants on how many people who need treatment for drug use disorders were perceived to get it, and this was very difficult for the delegates to guess because of the lack of data on both need and the lack of data on the numbers in treatment. So the national group estimated that somewhere between 2 to 10% of people who needed treatment were thought to receive it, and the provincial estimates ranged from 1.8 to 10%. Other comments included less access to treatment in rural areas and some provinces. So essentially, this is below the average access to treatment. Okay, the delegates then started to analyse the quality and coverage of different types of drug treatment in different settings. So one of the areas we looked at was primary care for people with drug use disorders. The coloured graph is the various ratings. So we've got the 4 provinces and then different groups' feedback in the provinces. So that's what the graph represents. Primary care, screening, brief intervention and treatment, which is this line, was thought to be inadequate in all but 2 areas. Basic health care for people with drug use disorders was thought to be partially adequate in Punjab and one area in Sindh, but it's thought to be better in urban areas. KPK had implemented WHO MH-GAP, which was thought to be good. Tertiary mental health hospital-based treatment was rated the highest of all different settings, and this is due to the dedicated beds in mental health hospitals. But these were not often in dedicated wards, which is what the recommended practice is. Okay, so in terms of HIV and internal medicine, this was a very mixed picture from feedback from delegates. So some good, some inadequate. It was thought to be inadequate across the board in Balochistan. In terms of emergency department responses, and this includes things like responses to overdose, most areas were rated poor in rural areas and in Balochistan, and the urban areas and some of the other provinces such as Punjab, Sindh, KPK were rated much better. Social welfare was generally rated as inadequate, with some pockets of good practice. Informal community settings were generally rated as inadequate or partially inadequate, and delegates talked about stigma being a major issue in the country. Treatment in prison and criminal justice settings was rated as inadequate or partially inadequate. Okay, let's now look at the top of the pyramid. So this is the specialised drug use disorder treatment services, the long stay residential, short stay inpatient, community outpatient, recovery orientated treatment, etc. So now in terms of all of this, in summary, outreach services for people with drug use disorders and recovery management, or this long-term treatment, was generally rated as inadequate or partially inadequate across all the provinces. Inpatient and residential rehabilitation services were rated the strongest as adequate or partially inadequate, apart from in Balochistan that was rated as inadequate. Treatment in all of the settings was rated as inadequate or partially inadequate. Now remember, what the international standards is saying is most people should be treated in outpatient services in the community. So we've got some real issues coming through here. So most of the treatment was thought to be in the top tiers, inpatient and residential rehab. That was the strongest, but the big chunks of treatment area recommended by the international standards was missing in many areas. When we looked at the actual detailed interventions, intervention coverage was very patchy and was generally rated as red and amber, as you can see by this diagram. So generally as inadequate or partially inadequate. The areas that were strongest as amber or green were needle and syringe provision in urban areas, assessment and treatment planning interventions, pharmacological withdrawal, and some recovery management. Punjab and Sindh provinces were rated higher. Balochistan province was rated mainly red. Mainly poor interventions were rated were interventions to prevent drug-related death, some pharmacological treatments, aftercare, mutual aid outside cities, housing and employment support. And this is worrying given the levels of opioid use in the country. Okay, in terms of system resources, there is some public resources for free or affordable drug use disorder treatment, which is great. This is inpatient beds in mental health hospitals, ANF activities, donor funding, and there's also this private sector of unknown size and quality. But the participants did not know how much resource was in the system, and they thought that this could impair planning. There was comments about resources being used in silos and some questions about how the resources were used. So clarity around resources would be helpful to aid planning. In terms of system quality interventions, there was no national data system for specialised drug treatment. Participants say that there was one previously and it was very useful, and they really would like this back. There was some good work happening on quality standards, particularly in the Healthcare Commission and particularly in Punjab, that had developed specific quality standards for drug use disorder treatment services. They hadn't quite piloted those, but that was coming. Workforce development activities, you can see the different ratings in colours here. There was some pockets of good practice, but these were not thought to be strategically organised or planned. It was very much dependent upon donor funding. The work of ISSUP Pakistan was thought to be good in relation to this. Activities to tackle stigma and discrimination. This was generally rated as inadequate and partially inadequate. There were some activities named as good practice by INF, but this was thought to be an area that needed much more work. Okay, so the delegates then looked at what the shape the local systems should be. And remember, we're looking for this pyramid shape. And these were the diagrams that people came up with, that we came up with from the provinces. So they're color coded, so green is good, amber is partial, and red is poor. And as you can see, there's a lot of similarity between the shapes in the different provinces. Generally, they're top heavy. So generally, there is a lot of residential or inpatient treatment and very poor or inadequate community-based treatment and recovery management. So this is Punjab, this is Sindh province, this is KPK, and this is Balochistan. Balochistan, I think, was rated as the most inadequate, despite there being pockets of good practice. Okay, so what did participants recommend for service redesign? Across the board, participants wanted better coordinated planning and transparency of resources. There was a strong recommendation to try and get this pyramid shape in each province in the country, therefore expanding that bottom of the pyramid, the outpatient treatment and recovery management. Delegates across the board wanted to increase treatment coverage, and there was a range of different ways suggested, including expanding the specialised outpatient treatment, expanding recovery support and mutual aid, expanding primary care interventions and social care, building on the national infrastructure, increasing the treatment for people for mild to moderate issues so they're diverted from developing dependency, and also targeted help for women students, people living in poverty and in rural areas. Every province recommended that we needed to tackle stigma and discrimination, and also what was recommended was the need for data on numbers and people in treatment. Okay, so to the conclusions. The conclusions are that the treatment model currently in Pakistan is an acute model rather than a recovery orientated model to suit people with chronic needs. And what this basically means is generally people can have treatment episodes, but they go in, it's short-term treatment, it tends to be inpatient, residential, there's not enough aftercare, recovery management, and so there's not enough recovery support. The current system, because of this reliance upon the residential and inpatient treatment, is high cost and low volume. Generally, you can get 20 to 30 times the number of treatment slots if you have community-based treatment as opposed to residential and inpatient. That's not to say you don't need the residential and inpatient, because you do, particularly with the high levels of needs in the country. The lack of aftercare and recovery support and the lack of outpatient treatment and this inpatient and residential model is likely to mean that you've got high levels of relapse and overdose death, particularly because you've got a lot of opioid use in the country. There's a significant lack of some of the key evidence-based tools for tackling drug use disorders, including opioid medication-assisted treatment, overdose prevention medication, mutual aid and recovery support. There's very few options for people that are not seeking abstinence and who don't want to go to an inpatient or residential treatment service. Tackling stigma, I think, is critical, and there is room for improvement across all system standards. So this is my last slide. So I think that there is definitely work to do in the country, as there is in many countries. But because of the high perceived levels of need, I think there's particular work to do in Pakistan. There was consensus from the participants to bring the system in line with the international guidelines. And I was very impressed by the dedication and the competence in many of the groups in national level and provincial level, and the enthusiasm to improve the quality in the system. The government commitment for this work is fantastic, particularly the leadership of the Joint Secretary of MCN, Mr. Sabino Sikandar Jalal, was most welcome, as was the participation of Dr. Saima Asghar, NHSRC, and also ANF were very participated in this work. The support from UNODC and INL is fabulous, and ISSUP Pakistan. There's many excellent professionals in the country, and thank you for having this webinar jointly with ISSUP Pakistan. I think you guys are the key champions to push this work forward, and my key message to you is, yes, improve the quality of the individual services, but please think systems. We need systems to address all the issues in the country. And just to thank you from me, it was my absolute pleasure and honour to do this work with you, and thank you for the opportunity to facilitate the work and to give this presentation. So thank you.
Thank you very much, Ms. Annette Dale-Perera, for this wonderful and very productive presentation for all of us. And I'm pretty much sure that will really help to understand the standards and quality assurance of drug treatment services, especially in Pakistan, and will really help to implement in our facilities the people, especially who are working in SUD treatment field as well. Thank you very much. We also received 2 questions for you from our audience, but we'll ask you in a Q&A session. Thank you very much once again for your presentation and valuable time here. Now I'm going to invite our next panelist, Mr. Sabino Sikandar Jalal. He is a Senior Joint Secretary, Ministry of Narcotics Control, Government of Pakistan. And today, he is going to share how Ministry of Narcotics Control, Government of Pakistan's vision and plans to improve the drug treatment systems in Pakistan. And I must like to add that he is the person who not only working as a government official or along with government, he's taking his personal interest and putting a lot of efforts to systemize and maintain the quality assurance of drug treatment services in Pakistan. Now I would like to request Sir Sikandar Jalal to present and share the initiatives and efforts of Government of Pakistan, especially Ministry of Narcotics Control. So welcome, sir, and please share.
Thank you very much. Thank you very much, Saima, for your generous words. And I'll start with my presentation. Can you put up the first slide, please?
Sure, sir.
Yeah. So these are a few figures. I'm sure all of you are familiar with them, but they're a bit outdated. They're from our survey in 2013, and things I believe are much worse by now. According to this survey, 6.7 million people were they had used some sort of drug, and 4 million were regular users. 78% were men, and 22% were women. And for 4.25 million drug users were considered dependent, and 430,000 people are people who inject drugs. So that is a very alarming figure, and that is the most concerning aspect for us all as public policy practitioners. That drug dependence in itself is, is pretty bad, but it has such a spin-off effect in terms of public health issues like HIV and hepatitis C and other such chronic diseases. So that is really a concern for everywhere. Next, please. Next slide, please. So again, some more figures from the same survey. The number of drug treatment facilities in Pakistan were just 96. So abysmally low figure for drug treatment facilities within the country. And with time, I think over the last 7-8 years, things have got much worse because we have not been able to add any more facilities or come up with a standardized treatment protocols for drug treatment. And government treatment facilities were just 25, and then private facilities 22 and 29. So really a very poor and dismal figure when it comes to drug treatment facilities. Next slide, please. Next slide. So as I pointed out, that the gaps that we've identified are these, that there's a lack of standardized evidence-based drug dependence treatment interventions. There's lack of certified drug treatment professionals. There is lack of coordination and integration between drugs, HIV, hepatitis, TB programs, and other key stakeholders such as law enforcement, prisons, education, judiciary, social welfare ministries, departments, and civil society organizations. Next slide, please. There's no mechanism or alternative to imprisonment for drug users with charges of minor offense. There's lack of database on drug prevention and treatment interventions, and there's absence of monitoring mechanism. Please go to the next slide. Lack of scientific and evidence-based drug prevention interventions for educational institutions and community. That is again, a very serious issue here, because we've learned from our discrete surveys in educational institutions that normally there's a prevalence of around 3% in higher secondary schools and colleges and universities for drug users within the student population. But there's absolutely no focus on treatment or prevention within the educational institutions. We are currently at 1:30. I'll beg your leave because we have a meeting planned with the Vice Chancellor of one of the universities to address these issues, and we've started a drive to approach all the Vice Chancellors and heads of major institutions to devise a mechanism to address this issue within the educational institutions. Again, there's a lack of drug prevention experts and professionals. We have started with the help of INL and UNODC, this program of UPC and UTC. We have some, a pool of prevention experts, but I think that pool is very minute or minuscule compared to the issue at hand, the problem that we face. There's lack of knowledge on prevention as a science as well. So we're really very poorly equipped to handle the scale of the issue that is confronting us. Next slide, please. So realizing all these issues, the government, in partnership with our partners in UNODC and INL, we are trying to establish a mechanism to ensure quality drug treatment and drug prevention services in the country. And how we are trying to do that, these are the points that I've outlined on the slide. We are trying to strengthen coordination and networking between relevant stakeholders at the federal and provincial levels, that they could play their role in drug treatment and prevention. We're trying to review and develop drug demand reduction related policies and strategies at federal and provincial levels by the regulatory authority and member departments. There's a process now on for certification and accreditation of the drug treatment and drug prevention professional services at federal and provincial levels. We are trying to monitor drug treatment and prevention services and to ensure some sort of accountability of the service providers. So these are the things that we are actually working on now in order to ensure a regulatory framework for treatment and rehabilitation of drug users within the country. Next slide. So DDR quality assurance mechanism, as I've discussed, we've already established a technical committee to oversee all this process with members from the ANF, Ministry of Health. PIPS is our institution which has the technical expertise to draft, our legal framework, which has to be approved by the National Assembly. Then there's Islamabad Healthcare Commission, UNODC, WHO, and UNAIDS. We've drafted a bill to provide framework and mechanism for drug prevention, treatment, and rehabilitation. We have conducted regular trainings with the help of our partners, and especially our mentor here, Ms. Annette Dale-Perera. We have conducted a series of trainings on DDR regulatory framework mechanism at national and provincial levels. Next slide. So this is the service organization pyramid, which is like sort of our model that we're following to institute, these drug prevention activities. We have learned, our experts, international experts, have taught this model to follow in order to ensure best standardized practices. Because this sort of model, it offers the most effective, least invasive, and lowest cost intervention in line with public health principles, and public investment should match the volume and type of treatment needed. Most interventions are required at lower levels, and most people can be treated in the community. So this is, I think, a cluttered slide. Hopefully you'll get a print of this, and so you can see what we're trying to do here. Next slide, please. So again, a pictorial depiction of what I was trying to say earlier. This is more on the practitioner side instead of a public policy perspective here, how to effectively tackle or practice what I've been discussing. So we have given a flow chart of it all, and I think all our trainers who were trained by Annette, they've gone through this training and they pretty much understand all these points that are highlighted in this slide. Next slide, please. So after the 18th Amendment in the National Constitution, a lot of responsibilities, especially in health and education sector, and as well as the social welfare sector, they've been shifted to the provinces. So any public policy initiative or any amendments in order to formulate a regulatory framework which is implementable all across the country, we have to take all these provincial partners on board. So in order to sensitize them to the issue, we have conducted a series of meetings with the provincial governments in order to come up with a standardized system to address all these issues. Next slide, please. So these are the findings which our consultant, Mr. Zahid, came up with about the treatment facilities available in the country. As you can see, that they're not very encouraging. In fact, they're quite dismal and poor, as I said earlier. There's really no excuse for all this malaise on the treatment and rehabilitation side. We have not really been able to focus from the government side on these activities, and we're hoping with the help of our partners that we'll be able to address this issue within a short span of time. Next slide. Again, the findings on the quality of the prevention, again, it's very poor, there's really no quality. Everybody is trying to just, I think, symptomatically treat all these patients, whereas I have always stressed that we need to come up with, opioid substitution therapy and methadone use. I've been an advocate of methadone use for treatment, and we're trying to convince all our stakeholders to come to that side for ensuring sustainable treatment of drug users. Next slide, please. So there is a strong support available within the stakeholders for establishing a standardized quality assurance body within the country. So this is just a pictorial depiction of that trend. Thank you. Next slide, please. So again, a few figures about composition of standardized treatment protocols, and the number of I think cross section of experts that our consultant has interviewed, and they all support formulation of new standardized treatment protocols for rehabilitation and treatment of drug addicts. Next slide, please. Again, a few more figures of the consultant study. So there's a strong support to come up with a standardized system. Thank you. Next slide, please. So this is the current status on DDR Q&A regulatory framework mechanism. In light of discussion with relevant stakeholders and information from the provincial interviews, TOR's SOP organogram and operational flow chart for the DDR quality assurance mechanism has been drafted. The draft bill on DDR quality assurance, which will go for legislation before the National Assembly, is being reviewed and with suggestion incorporations from discussion in the Quality Assurance Technical Committee meeting. We have drafted 2 documents which are being reviewed in the MNC. We have actually reviewed them and sent it to the Ministry of Health in order to get their opinion on the draft legislation bill for to process it with the Prime Minister and the National Assembly. Once the draft bill has been approved, it will be presented to the National Assembly, as I said earlier, and it will become an act for implementation across the country. So this is a pretty important work that we have undertaken with the help from our partners in INL and UNODC. So once, if we're able to draft this bill and get it through the National Assembly, I think it would be a game changer and very radical in implementing regulatory framework in terms of quality assurance for drug treatment and rehabilitation network. So we have our fingers crossed. We're all looking forward to finalizing this activity. Next slide. So this is all, and if you have any questions, I'm here for 5 minutes, and then, as I requested earlier, I'd have to leave for my next meeting. Thank all the organizers for giving me this opportunity to present my viewpoint, in fact, the government's viewpoint in this meeting. Thank you very much.
Thank you very much, Sir Sikandar Jalal Sahib, for your for sharing a very comprehensive presentation to share the overall scenario of drug use problem in Pakistan and to share the initiatives and efforts as Ministry of Narcotics Control Pakistan, along with the help and strong coordination with INL, UNODC, Plan Drug Advisory Program, and other collaborative organizations to ensure the quality assurance of drug use treatment services in Pakistan and as well. So thank you very much once again for your precious time and to share valuable remarks and as well as your presentation with us. Thank you. And now, on behalf of ISSUP Pakistan, I'm going to share a few steps and action plan of drug treatment system in Pakistan through its member network. Yes, and today, first I will give you a brief background. About substance use treatment. It will help to understand the whole scenario, and then I will talk about the objectives and mission of ISSUP Pakistan. And after that, I will talk about action plan of ISSUP Pakistan as well. So, if we talk about the drug treatment in Pakistan, the availability of proper functioning centers is vital in curbing the menace of drug addiction. 4.25 million drug dependent needs professional treatment. Available structure has only 1990 beds for drug treatment. Only 30,000 substance users get access to treatment every year in Pakistan. This means that over 4 million people who need treatment for addiction are not getting it. Majority of people are not able to afford the charges of this treatment, according to the UNODC 2013 report as well. Such centers are facing issues like insecurity, lack of trained medical staff, and less financial budget will decrease their efficiency from expanding their services to high number of addicts. Now, I'm going to share the mission of ISSUP Pakistan. That ISSUP Pakistan aims to establish and maintain a multidisciplinary network of substance use professionals and provide evidence-based substance use prevention, treatment and recovery support through its network of professionals in the field. And now we have a brief look on the aims and objectives of ISSUP Pakistan. Basically, to build a multidisciplinary and effective network of substance use prevention, treatment, and recovery support professionals, to promote educational reforms for the substance use prevention, treatment, and recovery field professionals, to recognize issues concerning drug abuse and its prevention, to enhance the ethical and evidence-based practice in the field of substance use in Pakistan. Here are some more objectives of ISSUP Pakistan: to develop policies and establish evidence-based, high-quality and ethical practices for substance use prevention, treatment and recovery. To professionalize the treatment, prevention and recovery support workforce in Pakistan. To develop and deliver knowledge system for evidence-based prevention, treatment and recovery support. To raise awareness regarding the effects of substance use and its prevention as well. To provide access to training, education and credential opportunities for the SUD treatment professionals as well. These are the main objectives of ISSUP Pakistan. Now, I will give you a brief introduction about the shared goals. Provides a foundation for collaboration as well. The goal of ISSUP Pakistan to minimize drug-related harms and promote and protect health and well-being for all. The idea of harm minimization encompasses the prevention and reduction of health, social and economic harms experienced by individuals, their families and friends, communities and societies from substance use. ISSUP Pakistan believes that in collaborative work with all the organizations and stakeholders to achieve these goals as well. We are also working to develop and implement a strategic framework for adult and youth for SUD treatment services in Pakistan. In collaboration with other stakeholders, ISSUP Pakistan wants to develop common tools and forums to share practice and celebrate success of foster system learning and improvement as well. Build on exciting SUD-related public education campaigns to shift SUD culture, promote help-seeking, and address stigma as well. ISSUP Pakistan also included in his goals that to develop guidance for improving substance use disorder intervention for services engaging in young people not in education or employment, because a large number of children and adolescents not going to school are forgotten. ISSUP Pakistan's action plan. ISSUP Pakistan will release a discussion document seeking feedback on appropriate regulation of drug utensils. Release a discussion document as well. I already told you that evaluate the alcohol and other drug treatment code pilots. Develop and implement an SUD information plan. Publish a literature review of population level SUD impacts and unmet needs as well. These were actually the main plans we are working over, and with the collaboration we need to establish a culture of research and publication so that we have to appropriate knowledge about the drug trends, treatment facilities and barriers to seeking treatment, and we are pretty much sure that together we can achieve our shared goals of drug-free Pakistan. And now on behalf of ISSUP Pakistan chapter, we are very much thankful, and that's all from my presentation. And we are also very much thankful for your active participation and listeners. So now we are moving for a question and answer session. So the first question is for Ms. Annette. So Ms. Annette, ready? We have a very small question because your presentation already cleared many of things as well. So the first question is that are the international standards for treatment of drug use disorders are available in Urdu format as well or not yet?
Okay, they're not available in Urdu as yet. I don't know whether or not they may be in the future, but currently not yet. Not yet, I think, is the answer to that.
Okay, thank you very much. A very short question and answer as well. So the next question is, were the prison settings evaluated for the quality assurance?
Okay, in terms of the training, we did get feedback from the participants on interventions in prison settings, including treatment. And the participants in the training that we did rated the treatment as generally as partially inadequate or inadequate. So they thought that there was some treatment, but they thought that the quality of the treatment wasn't very good. Now, this is participant feedback, so this isn't hard evidence, if you like. And generally, we would recommend that all treatment that is provided in prisons should be of equal quality to that in the community. So the international standards for the treatment of drug use disorders actually has a special section in it on treatment for people involved in the criminal justice system. So I would refer people listening to the webinar to that document and recommend that we all push for parity of quality for prison treatment. Thank you.
Thank you very much, Annette, for very well answered this question. So if you allow me, can I ask you one more question? The question is, thank you. Yes, thank you. The question is, what support we as healthcare professionals can provide in implementation of quality assurance for SUD treatment?
Oh, Saima, that's a huge question. Interesting. In one of my many jobs in my long career, I used to run NHS addiction services in London and the Southeast. And I think that it is the duty of everybody involved in delivering healthcare to have a mind on quality and have a commitment to quality and to understand the requirements on what we should provide and how we should provide it. And I think we need to do our best to do that. Now, there is international guidance. I would also recommend every country develop their own clinical guidelines and standards. And then I think it's down to every professional to do their best to strive to meet that. But in terms of if you're running a service or if you're involved in a service, I think one of the key things to do is try and implement a good clinical governance cycle where you're regularly looking at your standards, auditing your practice against the standards, trying to improve quality and put a formal mechanism in your service in order to do that.
Thank you very much, Ms. Annette, for explaining my question and very well answered. Hope the audience are satisfied. So I'm going to now end this webinar with the thanks that on behalf of ISSUP Pakistan chapter, Ministry of Narcotics Control, Government of Pakistan, UNODC, INL, and UNODC International. We are thankful for your joining for this important webinar on quality assurance for drug use, for drug treatment services in Pakistan. And we hope to see you all. And we are also very much thankful once again with the ISSUP Global team for always providing their technical and moral support for us to conduct such activities, especially Miss Olivia, Miss Livia, Miss Ola, and Ma'am as well. And especially for this webinar, Miss Anita really helped us to conduct this webinar because the topic was also suggested from her, and her expertise are also very much appreciable because she's the lady who worked in Pakistan on the ground reality basis. She had a lot of research and worked to assure and to establish the quality assurance system in Pakistan. So we are once again very much thankful to Miss Anita, Mr. Dr. Jeremy, and Miss Christine as well, Miss Ola from ISSUP Global. We are very much thankful once again all of you for your precious time to share your valuable remarks and wonderful presentation with us and our audience as well. So once again, I would like to also share thank you very much to all our audience, and hope to see you with the next webinar with a very important topic. And still that, take care yourself, be safe, and be connected with the ISSUP website, which is the www.issup.net. Thank you. Take care.